And
Can you read? Is that work? All right. My name is Jason Sneed. I'm with the Arizona Developmental Disabilities Planning Council. I'm the research and communication specialist. We primarily developmental disability committee and represent them and with different agencies. And we also provide grants that help with that. If they help with people with developmental disabilities. We're federally funded through the Developmental Disabilities Act of 2000. So it's federal money, and there's one of us in each state. So, we represent Arizona, I guess. So that's who I am.
thank you.
Hi there, I am Erin Lorandos. I am the Digital Inclusion Library Consultant for the State Library. We are the librarians for the libraries, if you will, at the State Library. So my job is to consult with libraries across the state on different projects, including telehealth projects and digital access and inclusion.
Samantha Johnson with Elaine Transportation. I'm the program manager there. Elaine is a small local nonprofit. We focus on providing no-cost transportation for people experiencing homelessness, as well as other major barriers to transportation.
Hi, I'm Mitch Reddy. I'm an associate transit planner at Flagstaff Mountain Line. We're a public transportation agency.
Hello, welcome. It's great to see all of you here, either in person or online. My name is Amy St. Peter. I'm the Deputy Executive Director of the Maricopa Association of Governments and helping to staff Age-Friendly Arizona. Thank you.
Hi, I'm Raymond Poza. I'm the Compliance Officer for the Community Health Center of Yavapai County.
Hi, I'm Carrie Straub. I'm the Assistant Director of the Yavapai County Free Library District.
Morning, everyone. I'm Kelly Williams. I'm the Director of Human Services here at MAG and very thankful to have you all here. Our team houses the Hezekias and Didi, who work on the 5310 grant, which helps provide transportation to disabled and older adults. And we have a real interest in this work. So glad you're all here.
Okay, and I see we have about 15 people online. And so I'm going to kind of read off the names. And if you wouldn't mind just kind of testing your audio and discussing the organization you work with. But let's start with Jane Lang.
Hello, I'm with the Arizona Public Health Association.
All right, thank you, Jane. Mauricio.
Hi, good morning, everybody. Mauricio Roscoe, Community Engagement Manager for Care First Health Plan.
People are jumping around on me. Let's go, Paula Mayer.
Hi, I am the Chief Medical Informatics Officer at Tuba City Regional Healthcare Center, and we are a tribal organization with a 73-bed hospital and outpatient clinics.
Chris Hansen.
Hi, I'm Chris Hansen. I'm the Market Vice President for the Midwest and Arizona with Humana. I'm happy to be part of the conversation again.
Thank you, Chris. Andrew. Andrew Carpenter.
Hello, I am, sorry, I lost my cursor. I'm Andrew Carpenter. I'm the director of the National Center for Applied Transit Technology. So we're excited to get to keep working with you all and listen in on all of this.
And then Eric with N-CATT.
Hi, everyone. This is Eric Lang with N-CATT. Great to be here today.
Hector.
Hello, everyone. Happy Monday. My name is Hector Araujo. I am with Unitas in the Community Cares Initiative here in the state of Arizona. We are one of the technology platforms that are helping connect social care to healthcare and preventative care. So excited to be a part of this meeting. Saw Lane Transportation was in here. So Samantha, hello. And Eric, if you're here, hello. And hello, everyone.
Great. Janet.
Good morning, everyone. Welcome to Tucson. Janet Major here. I am the Associate Director for Innovation and Digital Health for the Arizona Telemedicine Program. Do quite a bit of outreach, put the tele into telemedicine and telehealth. And I've had the opportunity to work in telemedicine for 25 years. And we are also a Southwest Telehealth Resource Center, or one of a dozen national regional telehealth resource centers. And we've done quite a bit of work up in the Four Corners area, along with our libraries, which is a pretty exciting project that I'm hoping we can collaborate on here with this group. Thank you.
Thanks, Janet. Jared.
Good morning, everybody. Jared Trzynski from Arizona State University, Osher Lifelong Learning Institute. So we help learning initiatives for 50 or better communities. Really excited to be part of this today and listen in. Thank you.
Okay, Jason Matthews.
Yes, good morning. My name is Jason Matthews. I'm the Assistant Director over at the Maricopa County Human Services Department, overseeing our Senior and Adult Services Division. I'm also have the pleasure of being on the MAG Age-Friendly Arizona Leadership Team. So I'm really excited about this topic as it intersects two things I'm very nerdy and passionate about. So really excited about the conversation. Thank you for having me.
Great. Jessica with SEGO.
My name is Jessica Aguayo, and I work with SEGO, Southeastern Arizona Governments Organization. We're on the southeast corner, and we cover Cochise County, Graham, Greenlee, and Santa Cruz County. And I'm the Regional Mobility Manager.
Okay, Vince Torres.
Yes, hi, good morning, everyone. Vince Torres, I'm the Associate Director of Customer and Community Success with Unite Us. I work closely alongside with Hector. So, and many of you I've worked with in different facets over the past few years. As Hector mentioned, we're a cross-sector collaboration software organization. So we do partner with many organizations throughout the state, whether they be providers, government, nonprofits, or health plans. So looking forward to additional conversation for today. Thanks for having us.
Will Humble.
Morning, everybody. Will Humble. I'm the Executive Director for the Arizona Public Health Association. Thanks.
Zena.
Hi, good morning. My name is Zena Gagnon. I'm with Central Arizona Governments and Sun Corridor MPO. I am the Mobility Manager Coordinator. Thanks.
And then Miriam.
Good morning. My name is Miriam Margulis. I am with AmeriCorps Seniors and NA Union University. I am the program manager for Southern Arizona.
Okay, great. So I think that is the extent of the names I have, but is there anybody else that I've missed? If you hit, it'll go green.
Oh, there it is. Okay. Corey Christians, Yavapai County Library District. Here to represent the libraries in Yavapai County.
Anyone else online? I think there's a couple guests. Okay, well, please feel free to utilize the chat or raise your hand or just kind of jump out throughout the conversation. I will say that's maybe one of the smoother virtual introductions we did. Everyone was on, no one had muting issues, so that was pretty slick. So well, great. Well, so Hezekias, would you mind kind of shrinking that a little bit? Again, so we are close to being on time already, so this is pretty good. So what I do want to talk about now is a little bit of a day 1 and 2 kind of findings and an overall draft vision. And so I know that there's some people in this group that have been with us kind of the whole time. There's a lot of other individuals that have kind of came and go, and I know some of them, this is your first meeting with us. And so hopefully this will provide a little bit of a recap as well as sort of an extension of some of the work that's taken place since that May 9th meeting. And so I think from the conversations we had back on March 31st and in May, I think that there was this kind of big two overall major themes that we identified. One is there's absolutely an awful lot going on in the world of healthcare access as it relates to transportation. And so I think a lot of the kind of participants that we had, that there was way I'm framing this is just a lot of big picture items, is that, overall that there is a need to collaborate at the highest levels of healthcare, There's a lot of opportunities that where people were interested in discussing and exploring further on ways to combine some of these kind of larger efforts. There's also, it was recognized as a need for meaningful partnerships between healthcare and transportation providers. And I think overall, the biggest takeaway that I think I had was through this summit, I think that we were on the right track in terms of there being an appetite for these types of conversations around healthcare access. And so we were really, really pleased. And I think that the attendance in these summits kind of speak for themselves in terms of, yes, we're on the right track. And this is something that's definitely worth continuing to have this group working together towards some of these areas. And so we kind of recognize that there's sort of this almost like parking lot concept of a lot of big picture items, and identifying a platform for continued conversation is very much warranted. At the same time, we also saw tons of opportunities to get started on things. And so I think we identified that, making the right connections is something that we've, I know from coming from strictly the transportation side, I've learned an awful lot on the healthcare realm. And I think that a lot of the other community partners can kind of mention the same. And so that there's a lot of different ways to improve healthcare access, that it also includes looking at, instead of bringing the individual to the healthcare appointment, bringing healthcare to the individual. There seemed to be an appetite to pilot things at a local and regional level, and then identify opportunities to kind of expand that across the state. And this was definitely an area where we felt like that there was some real opportunity in terms of funding to actually get started on some of these pilot projects. And so with these two kind of themes, how that kind of further was iterated, and this should look familiar because this is what we utilized back in May, but there's kind of this concept of forming a healthcare and transportation statewide task force to kind of take a look at some of those, tackle some of those items there. And I think what we were starting to see is, one, there's probably a lot more work that needs to happen in this space, and to kind of identify some structure around it. But these summit meetings kind of served as a starting point for that, and potentially that there's a role for this healthcare transportation task force to guide some of these pilot initiatives that we're kind of looking for. And so those two pilot initiatives that we spent quite a bit of time back in May talking about, and I think we spent a lot of time looking, building on that, is one, looking at local telemedicine options. Again, really a high emphasis in looking at telemedicine. And then secondly, identifying ways that technology could support healthcare and transportation communication options. And so this is kind of where we had that meeting on the 9th, where we had some very open-ended discussions around very broadly talking about these topics. That since that time, I know that our kind of internal planning teams reached out with a lot of you and tried to kind of shore some of these items up, and with the big goal of bringing something back to you guys today that we could kind of present a vision to then we could kind of pick apart collectively, as well as explore some of the potential next steps related to it. So is there any questions so far? I'll kind of pause real quick if there's any comments online or in the room. Okay, what I'm going to jump into is kind of the grand vision. Again, this is a collection of a lot of information that we unpacked over the past couple months, essentially. But it's overall, it seemed like a lot of themes were pointed to this kind of overall concept of, an individual needing healthcare access, providing an opportunity or recognizing that there's conversations that maybe aren't taking place, but finding ways to better facilitate ways for the healthcare partner, the patient, a healthcare plan, whoever's involved, to look at healthcare access, and then kind of bringing in this potential. I think this is a very general frame for this, but it's sort of some sort of no wrong door platform that I think with the key piece here is trying to recognize the individual needs of that patient as it relates to the various options that are around. And so, I think traditionally it was, hey, there's patient needs a ride to the transportation, or they need transportation to get to their appointment. So kind of this is the overall angle that was taken. I think that also don't confuse this icon for an ambulance. This is we're actually suggesting more like public transportation or volunteer transportation, but hopefully that gets the point there. But we see an opportunity as well, again, to be able to have this conversation, to look at, hey, what are some other options of bringing healthcare access to the individual? So, and that where I think ties in with some of our pilot projects about looking at how can we build that infrastructure to actually have some of these kind of end pieces there. And so Telemedicine Hubs, and that's some of the partnerships with the local libraries, as well as also looking at in communities in Arizona. I think it's particularly relevant for locations where we could actually bring a telemedicine van out to a rural pocket of Arizona. where maybe they don't have the infrastructure for that telemedicine library to satisfy that. So I think, again, many different directions that was taken, but this is kind of our effort of compiling everything and also tying it in with some of the running start we believe we have on some of these pilot projects. And so I'll kind of continue to talk through these a little bit, and as it sets the stage for today, I think this is sort of the elephant in the room, is that from the local transportation standpoint, this is an area where we're obviously very challenged right now. I think that there's some slides I'll have that talks about the funding mechanisms that are out there in terms of the traditional transit funds. But I think that overall, a theme that I think came out is, hey, that there's a lot of opportunities to kind of look more creatively at healthcare access than the avenues that we traditionally have. And so with that, I don't think we're going to spend a lot of time today kind of breaking down the actual transportation elements. We're actually going to look at some of these other items, but recognizing that this is sort of an ongoing need, that obviously there's a lot of staff and resources dedicated to continue to grow this network. But the transportation could also function to take individuals to those local libraries, those local telemedicine hubs, or even potentially take people to a local area, to intersection on the road or wherever the potential healthcare vans could be parked. There's still a transportation arm associated with all of those. So, but just because I have the microphone, I do want to give a little overview of the challenges of the transportation side of things real quick, and then we'll kind of move past it. But I did just want to share this information. This is the Federal Transit Association, or Federal Transit Agency's funding allocations in Arizona, and the blue boxes represent the amount of funds that were requested. Orange is how much was actually received. And so this just kind of helps paint a picture of discrepancy here between need for supports for transportation and availability of funding, which again kind of points to our opportunities to look in other alternative creative ways. One potential topic for this group, if we were to decide to continue to meet beyond this this N-CATT kind of series of summits, is taking a look at how we could better kind of partner our public transportation entities with access. I think there's a lot of work that could be done here, and I think there's a lot of opportunity, but I kind of wanted to introduce all this to maybe get out of the way and recognize that we probably won't be talking about this today, or I'm hoping that we don't talk about this today, but this is kind of providing some background. So with that, I'm going to jump to what we are hoping to talk about today. And so one of this is this concept of this no wrong door platform. And I think that this was a continuation of the conversation that I believe Amy was running on May 9th around the existing kind of efforts that we're having to create a communication platform between transportation providers and healthcare providers. And I think that sort of the problem that this grew out of was just lack of communication around missed appointments. And sometimes that if appointments are being canceled, that information wasn't ultimately making it back to the transportation provider. And so we kind of recognized that, hey, there's a lot of opportunity to improve that communication between the transportation provider and the healthcare. This is sort of adding on to that and recognizing a grander vision that could potentially be related to that, and saying, hey, while we're factoring in that individual's needs. And so that's just kind of where we're considering in the scheduling environment, taking into consideration the transportation and the available options, as well as potentially some of these alternative ways to access healthcare, being telemedicine. So this is kind of looking to house that through some sort of kind of tech platform that could better match and easily integrate scheduling with these different healthcare access options. So this is a very complex initiative. I think this is definitely something that even just trying to address from the transportation alone is something that's, I think the N-CATT team could probably attest to this a little bit. Something that's being pursued across the nation. And so we actually included here, I don't think we'll be able to play it, we'll play it today, but there's an interesting example out of Iowa with that Ride Herta at the bottom there, of their attempt to just focus squarely on the transportation side of this, but they are working to kind of build that platform for transportation. I think we could look to harness and potentially build upon to look at other healthcare access options. So is there any kind of questions on how we took the conversation from May and got to here so far on the No Wrong Door platform? Okay, what we're hoping to do is, as on the agenda pointed out, spend kind of 20 minutes really diving into this at another point in the meeting. And we're going to do that for each one of these little initiatives I'm going to run through. So the next item is the Healthcare Telemedicine Hubs. This one's a little bit more self-explanatory. There's a lot of phenomenal work that's already being done in this space in Arizona. And I think that Janet and her team and with the library district, they have a lot of great information that and some options that have been deployed so far in Pima County. And I think a kind of a goal that came out of this was, looking at potentially having these telemedicine hubs in every county of Arizona. And I think that's it's a long way from where we are right now, but it's also probably doesn't fully address the total need. But I think that's kind of an interesting benchmark to be looking at that we can kind of start from in these efforts, but then continue to build upon. And I think that there's to begin in the areas with the greatest needs, willingness, and partners. And so I think that happy to see Yavapai County here. I think that's one of the opportunities we identified, as well as looking in the Southeast Arizona area. And so there's some partners we have on board for that as well. So that is the telemedicine hub piece. This is just, again, referencing my favorite map, distance to healthcare access and kind of the strategic rationale behind picking some of these locations. Southeast Arizona, obviously a great need there in terms of distance to healthcare. And in Yavapai County, I definitely think there's some pockets throughout Yavapai County that also face that similar need. So I think that it's great to be able to tie all those pieces together there. And then lastly, looking at the mobile telemedicine hubs, the telemedicine vans. The opportunity here is that brought into areas without infrastructure, as I mentioned before. But I think this is also a really cool tool that has a lot of applicability beyond just telemedicine, bringing telemedicine to some of these areas. And I think it can easily be integrated with other kind of healthcare related initiatives. I think Tuba City, in some of the initial conversations we've had, they have some ideas about this. And so I think the opportunity that we identified here came out of the May meeting was that Tuba City Regional Healthcare actually tried to go down this path in the past. They were unable to utilize the funds that they had been rewarded for an actual vehicle. And so they went through and outfitted, they have all the equipment to outfit a van, but they're just missing the van. So that's kind of the gap there and the pilot opportunity, again, that we kind of saw here that we wanted to build upon. So, and again, we will be talking in depth about each one of these initiatives here coming up, but this is just sort of a initial rundown. So with that, are there any questions on this kind of overall vision? Does it make sense? Is it, sorry, I'm jumping.
I have a quick question.
Yeah.
And the only reason I ask this is because I partner with this organization, but I know that Area Agency on Aging is a huge source for a lot of agencies that have and/or involve seniors. Have we partnered or have we brought anyone representing that organization to this conversation, since they provide like that 24-hour number where people can call in right away and get answers to some of these questions?
I would say that I know on the March webinar, we did have participation from multiple area agencies on aging. And I think that they could easily be incorporated if there's an interest. So.
Thank you.
If I could jump in, Jason, not to put you on the spot, but I guess I am putting you on the spot. Do you have anything to share from your work with the county and working with older adults?
I do. Can you, sorry about that. I had some audio issues there. I think that there is some opportunities. And Miriam, I did actually write that down too, because again, I wasn't quite, this is my first meeting in this space, but I do feel that the continued conversation with all of the area agencies across Arizona. I know I'm thinking obviously about the one here in Maricopa County, which does help connect others with that transportation access for a lot of the things that we're talking here, especially for the first star, that local transportation provided to in-person appointment. There's also been Maricopa County Human Services also does have a very, very small transportation contract that has also been helpful in this space, but has also been broader than just this particular population. I think that that's been also working with those that are experiencing homelessness and other kinds of things. But I wrote literally, I think as soon as you were talking, I was finishing my notes to myself as far as looking to see what kind of opportunities here, because I think that there even could be, whether it's modifying existing, say a contract, for example, if that's even like a low hanging fruit for a future kind of thing, or just seeing how there's other ways to better integrate with older Americans and throughout. And Miriam, I'm going to just go even one step further, and I'm going to build upon your question and just kind of add in kind of an observation from my perspective. It's also just making sure to have those integration from even those opportunities within the Maricopa County system. So for example, they run a library district as well. So it's like, I already wrote down like libraries, the same kind of thing, but yeah, that's more for me to kind of like explore in the space. So I'm really curious, but hopefully that helps kind of, with my processing, if that makes any sense.
No, it's perfect, Jason. Thank you very much. Really appreciate you jumping in on that. And
It does.
and agreed. I mean, I think the area agencies on aging, the libraries, there isn't any one sector who can cover this need all by themselves. So we inherently have to work together. And I think there's some really good opportunities, plus a culture of collaboration across the state. So I think all of that can be really leveraged. Thank you, Jason.
Great. So just kind of one final recap here. Again, recognizing that we believe that there's an opportunity and there's a need and there's an appetite to form this healthcare task force that, again, I think could incorporate additional partners, as we mentioned, but also really help kind of guide some of these potential initiatives that we see, as well as tackling some new items as we go. And so I think that's kind of one of the mechanisms that I have in the back of my mind when I think about this whole kind of effort, this whole big push. And what we're kind of hoping from this group is that there's an interest in, continuing along this kind of task force angle as we explore some of these specific items, but then recognizing the need to kind of tie in together this greater vision. So with that, I do believe that I'm going to jump through all those slides again. And what we're hoping to do is, it's 10:30, we're on the nose. Spend some time, hopefully, kind of diving in a little bit more to this no wrong door concept, this communication platform. Spend about the next 20 minutes kind of unpacking this and hoping to find a direction and some next steps for our group to take.
Excellent. Thank you. So as Todd was saying, that the impetus, the catalyst for no wrong door approach really came out of an assessment of what are our biggest transportation needs, knowing that there are many and they're bigger than what we can address, particularly all at one time. So we wanted to be able to prioritize, and we found that particularly long distance, non-emergency medical trips, we just don't have enough resources for those right now. And when we look at the rides that are requested, the number one ride that's being requested is to that medical care appointment. And so then we started looking at, are there different ways that we can meet this need? Because we don't have enough resources to be able to meet the need just outright. We can't, there's anybody who can just write a check and say, okay, got it covered, next. So we're looking at how can we address this with different kinds of options. And so one of them is being able to streamline the communication among the healthcare provider, the transportation provider, and then the patient or the client being transported. Because we find that that generally about 20% of appointments are missed, and they're missed because of the communication breaking down between those three entities. Often the transportation provider is not necessarily in the loop. Sometimes they are. Ideally they are, but sometimes the changes are made directly with the patient, and those are not then communicated to the transportation provider. Now, for some patients, they can cover this on their own, and that's fantastic. So this isn't necessarily a need for every single person, but it is a significant need for some. And so we want to be able to help to streamline that communication, so those appointments are not missed. Because when those appointments are missed, it's a drain on the healthcare provider, because then they have basically a no-show. It's a strain on the nonprofit provider, because then they're transporting someone when they don't need to, and they've likely said no to another ride that maybe did have a scheduled appointment. And then, of course, it's harmful to the person who's then missing that medical appointment, but they're still going on that long ride sometimes. And that can be really taxing for folks. So we wanted to try and figure out something different that would be able to help, particularly being able to leverage telemedicine, because in some cases it's very appropriate and much more effective to have someone participate in a telemedicine appointment as opposed to them having to be transported, particularly over long distances. So we have some options that could be further leveraged, but we're looking for a platform where we could coordinate all of that communication, because we have some really good resources in place, but it's in specific areas. Like, for example, through Age Friendly Arizona, we have a centralized database of all the human services transportation providers, which is great. It's not at all connected to the healthcare community, and so there's some opportunities there to at least build bridges, if not find a platform that could accommodate all of this communication that's really necessary. And so we're really excited to be introduced by the Cloud Innovation Center over at ASU, to be introduced to Unite Us. And I know we have Vince and Hector online, and I don't know if they might want to talk a little bit about their approach, but the Unite Us platform is a really great resource because it connects all different kinds of sectors. Because of course, transportation, I mean, in some ways you can view transportation as being about, planes, trains, automobiles, but it's about the van, or it's about the bus, or it's about the volunteer driving their own car. But at a deeper level, it's about the origin and the destination. It's about why somebody needs that ride in the first place. And so it's connecting them to healthcare. It's connecting them to social purpose opportunities. It's connecting them basically with their communities. It's connecting them to the people, places that they love and that they need to have in their lives in order to live a really full life. So taking that more holistic view, we need a platform that can connect to all different kinds of sectors, including transportation and healthcare, and be able to streamline what that looks like. So Unite Us has that, and they are implementing throughout the state of Arizona. And they've been fantastic about kind of exploring this with us. So can we leverage this platform that's already in place? And can we leverage this to improve the communication flow among these different providers to achieve a better outcome that really benefits everybody? Vince and Hector, is there anything that you'd want to add about the Unite Us platform?
Amy, I thought you rocked that. That was a really good debrief there. And I know that we were in the breakout session in our main meeting. So I think that really encapsulates what we discussed. I think, Unite Us brings together sectors through this technology platform, just to make sure that we're meeting the needs of individuals and families. We really tend to focus a lot on the social determinants of health. And a lot of your visuals that you've had on your slides really resonates with me, because we're looking at that no wrong door platform, but putting the individual or the family at the center, and then that all those needs are met around that individual or family member. So just looking at really that whole person care lens. I would just note that as we move forward in the task force and some of this work and conversation, I'd be interested to see in how a lot of these arenas, so transportation, healthcare, there are some challenges with regard to sharing data or sharing information, communication levels. There's just different levels of capacity. So even though we may have something that is going to increase coordination and communication, we still have additional things to think through around network capacity and adequacy. So those are some things I think we might want to keep on our frame of mind when we're moving forward. But the platform itself is very proven. We're located in throughout the US. And Hector, I want to turn it over to you, because I think you actually have a little bit more insight on the platform itself.
Yeah, no, thank you, Vince. That's a great synopsis. Amy, great tee up as well. And hello, everyone. And for some of you on the call, we have had these conversations with you all, as we are having conversations with your organizations and learning from these transportation agencies of how we can better use our platform to help streamline some of the things that are being brought up here today. One of which team is listed here on the screen that we're looking at. So on that fourth point about no wrong door platform, and the beginning with pilot phase of streamlined transportation / provider communication, our platform allows for that. So I know that we're talking about anyone can be onboarded, et cetera. You don't have to onboard your entire organization and programs onto the platform. We can pilot one at a time to gauge capacity, gauge interest. Is it really a streamlined approach? Are we creating capacity for you? And then also, team, something that I continue to hear is that communication piece, those missed appointments. our platform, like any other platform that you all use, whether it's from a social media perspective on Instagram or what have you, to anything else that you utilize from a CRM tool, just like our platform, all of those also are upgraded and iterated as the users provide feedback. So we take a lot of that feedback from the users across the country to help streamline our approach and remove barriers on the platform. One of which is created is our chat functionality, so that now you as a provider through the platform can speak directly to a patient and or provider if you need to reach them in real time. So imagine a messenger within the platform that you can communicate with someone on the other side of that organization and know exactly whom you're talking to in real time. So I'm going to just leave that here on the table, team. I'm going to be here the entire meeting. So if there's any questions or any of you'd like to learn more, we're here. And we can always schedule some one-on-one time outside of this. So Amy, thank you for teeing us up. Thank you, Vince, and glad to be here, team.
Excellent. Thank you very much. Thanks. Thanks to Hector and to Vince. So I think this platform can really help us. And we're looking at being able to pilot out. It's interesting too, because when I was first thinking about this pilot project, I was thinking more in terms of, can we pilot out the technology? I'm not sure that's really what we need to pilot out. It's more how we use the technology. So it's actually piloting out the partnerships and the practices around that technology. So we'd love to find some partners to help us with that, to help us dig into this a bit more. As I said, the platform itself was really built more around referrals, but they've developed some enhanced functionality on the site where that provide for and allow for that instant communication with that direct messaging. So I think that's a really good enhancement. Also looking at, are there ways maybe perhaps in the future where we could have more direct scheduling of appointments? So not just is that appointment being rescheduled, but could we schedule an appointment? And then even taking it further beyond that, when we think about those social determinants of health, it's important to think about that really broadly. So in some states across the country, for example, the doctor can write a prescription for housing or for a food box. And all those things greatly impact one's health. But currently, we don't necessarily get prescriptions for those. But what a phenomenal idea to be able to bring together all of the resources that people need in order to be healthy and to have their well-being really enhanced in a meaningful way. And so a platform like this, because it does have a broad purview, it really helps to facilitate that conversation. So the technology is there. What we need now are the partners around the table who can help us to leverage the technology that really exists already and could be enhanced even a bit more, kind of taken to that next level. But can we pilot out the partnerships and the way that we work together maybe differently as a result of having everyone participating in that No Wrong Door platform? I want to open up and see if you have questions, to see if you have feedback. Does this resonate? Is this something that would be helpful? Because we don't want to go off and do something. It's like, oh, that's nice, but then it doesn't do anything. You know what I mean? So I'd love to get your feedback on, is this something that you could see benefiting your clients, your constituents, and how we might think broadly about this? Sam?
Yeah, I'd love to know more. And I think I've asked Hector before about the capacity for integrations with Unite Us, because one thing I see is a lot of hospitals, for example, they already have their own internal referral platforms. And so being able to take everyone who already has their own internal platforms and then centralize those, I see that as being a big challenge.
Yes, Sam, great question. Vince, Hector, I'm not sure if you'd want to address that. Yes, sir, the floor is yours. We see you, Hector.
Yeah, Hector, go ahead.
So team, phenomenal question. And the answer is yes, we do have integration depending on the platform. Now, mind you, there are a robust amount of platforms that are used by healthcare agencies, providers, et cetera. So we don't integrate with all of them yet, but we do have a core of integrations that we do have currently just based off of the use cases here in the state. Now, depending on what system you use, you can share that with me and I'll let you know if it's either on our integration currently, meaning that you don't have to duplicate work as you're onboarding, and or if there is one that you use, we do have a handful that are what we call on our roadmap that will be able to integrate hopefully by the next quarter. And so there are a handful that we keep hearing from partners about what they use. And so we're making sure that our systems are integrating with those as well. So I can share with the team here which ones we currently integrate with. I can share it in an email with everyone here, and then what's on the roadmap as well.
That'd be perfect. Thank you, Hector. And just want to call attention to those who are in the room and maybe not watching the chat, that for the community-based organizations, there is no cost to participate. So you can sign on for free, and they're wanting to enroll more agencies because it helps them to build out their network too. So I think it's mutually beneficial, which is great because when we're adding value for our partners, then we're more likely to keep our partners. So, yes.
Just from the digital literacy standpoint, of course, one of the things that the state library offers are the Connect Arizona Digital Navigators.
Yes.
And so I see a role there for, the teaching of the tech that will be able to connect everyone. And of course, with our libraries directly, any partner that might be the spot where, there's a connection point can really play a role in helping people learn the tech, get access to affordable devices and all of that as well.
Definitely. No, fantastic point. And as much as we talk about technology, it still needs to be human-centered. So for example, even if someone is participating in a telemedicine appointment, they likely still need a companion there, either to help them access the tech or to help them just take everything in that they're hearing at the medical appointment, and then to help them track their care moving forward. So I think that's a really critical component.
And one more note on that, many of our conversations around telemedicine, I just want to make a distinction between tech version of Digital Navigator and the Health Navigator. Libraries are often in a space, especially over the last couple of years, that have put us in a public health almost sort of situation, as I'm sure you're all aware. And, there is a lot of fatigue around that. So just making sure that we make, that distinction and in our training and everything, I think that's really important.
It is. No, thank you so much. And it's a great example of where it's really important to have partners from different sectors, because where some can step in and others might need to step back. And it's important to be aware of when each may need to step in or back a bit. We have some great examples, for example, with Verde Valley Caregivers, where they have retired healthcare professionals serving as volunteers. So they cannot just drive the person to their appointment. They can actually help them to understand, okay, what did I just hear? And, as they're processing everything, then they can help them to kind of track all of that. So, and there are other programs that have similar arrangements with their volunteers too. So thank you. Yes.
She stole one of my questions about accessibility. So no, that's fine.
Yeah, that's good.
Well, one of the other ones I have is like, what if it's in a rural area that it doesn't have access to the internet, or so that would be a component.
Yes, absolutely. And that dovetails very nicely into the Telemedicine Hubs. So the idea is that particularly for rural Arizona, they don't always have access. And so can we develop either a hub that has all of the access, the internet, the equipment, everything right at that one central location? Can we transport people to that closer central location? Or can we outfit the van, and then the van brings it to the individual who's needing the access? So no, great question. Thank you. Definitely.
Just, I wanted to mention Will's comment here in the chat. I guess, Will, I was curious if you would mind maybe providing a rundown. You're asking, is this the platform that everybody's talking about? And has it included a link? I guess I'm just curious if you could kind of talk us through that that resource you're sending.
Oh, so this is my first meeting, so I'm kind of a rookie here. And everyone's talking about the No Wrong Door platform. So I just Googled it, and this is what came up. So I was just asking, is this what you're talking about?
Oh, that's okay. And Hector, thank you very much for providing the link. And we'll make sure that folks in the room have access to that link as well. But it's unitus.com networks Arizona. Oh, there you go.
Amy, can I just jump in real quick as well? I'd be remiss if we didn't mention that in partnership, Unitus works closely with Access and Contexture, who is our Arizona HIE, for a lot of the rollout of the Community Cares program. There are multiple layers to this work, whether you're a CBO organization or a non-CBO organization or a state agency. So it gets a little bit complex as you tease through that. I know, Hector, we provide a lot of information sessions throughout Arizona routinely. So we're happy to also share upcoming community information sessions where we can share and dig into that a little bit more in detail. But I just didn't want to take up all the time in this meeting, but we can answer a lot of those questions on the side or follow up with you as well to go over any of the detail.
No, that's perfect. Thank you very much. I appreciate you putting the link for Contexture in the chat as well, and we'll make sure that that everyone has access. Zacchaeus is so good, man. You just say it and he brings it right up. Thank you. So we'll get this information out to everybody, but would really encourage you to take a look at it. It's a great platform. It's a great program, and I think we have some really nice opportunities to be able to partner here. Sam?
If I may ask one more follow-up question, I've seen this website before, and I've seen that it's in collaboration with 211. I never actually followed up and to find out what the nature of that collaboration is.
That's a very good question. Hector, Vince, is that anything that you'd want to speak to?
Hector, you want to take that one?
Yeah, absolutely, team. Thank you so much. Phenomenal question as well, man. So thank you for bringing that up. And so, team, as Vince mentioned, there is a cross collaboration between ourselves, Access, and 211 Arizona Solari Crisis Human Services, which means that they will be uploading their entire database to the Unitas platform to have folks be able to filter through and look out for specific service types that they need. So focusing on the social determinants of health. Now, that doesn't mean that every single one of those agencies or nonprofits or community-based organizations are on the actual platform, but that doesn't mean that you will not be able to see their information in the directory. So we want to make sure that we're not creating any barriers or access to information. And so we want to make sure that everything is visible, and we'll slowly begin to onboard all those organizations if possible, but know that all that information from 211 will be uploaded onto the Unitas database.
Excellent. Thank you, Hector. Very good. We have 1 more minute to talk about No Wrong Door. So then in summary, it does sound like there's some interest in pursuing this, which is fabulous. If anyone is interested in possibly being either a pilot project partner, so helping us to pilot out this kind of new way of working together using the Unitas platform, and or just serving on kind of an advisory team to help us think through what are some of the questions that need to be answered, who else needs to be at the table, what's the best way to carry this out. We'd love to be able to continue this conversation with you. So if you have interest, please feel free to reach out to us, to me, Todd, Kelly, and Hezekias, and we will loop you right into that conversation. Kelly.
I think it would be particularly helpful if anybody online or in the room is also an organization that is currently using Z codes. I know we're not diving into the access conversation today, but I do think that that is an important potential funder of this work, and it would be helpful to have someone with that experience also in the conversation.
Yes, thank you. Because depending on who you ask, we get different information. So we need to kind of drill down and figure that out a bit better. Because if folks are, and for those not well versed in it, which I'm still have most of me in that camp. Z codes are the ways, are a billing mechanism, so the agencies can get reimbursed from Access for providing certain services. But you have to be enrolled, but it could be a great revenue source for agencies who are already doing the work. And if we can get you signed up, then maybe you can get reimbursed for that work. So that is a lay perspective on that and definition, but would love to continue that conversation with you. All right. Anything else on No Wrong Door? All right. Todd, I think, are we?
Sure. Nope. Thank you. I think that was a great conversation. And I think that what my takeaway is that there does seem to be interest from this group to continue along this path. And so I think that we got a great running start there and some great partners and it's angles to explore. So next, I do want to use the right mouse. And so I think that we might actually have some additional time here built in, which is great because I'd like to introduce Janet Major. She has a tremendous amount of knowledge on all things telemedicine, all things kind of rural healthcare access, it seems. And she has prepared a pretty extensive resource collection that I did send out to the group on Friday. And so, Janet, I did want to provide you 10 minutes until 11 to kind of, run through. I know at one point we talked about 5 minutes, but I think we'll give you, we found an extra 5 minutes for you. And Hezekias will be able to pull up the slides that you provided if you wanted to kind of help us make that transition into sort of the hard infrastructure elements around telemedicine in Arizona.
Sure. Thank you so much. Could I bring him up myself, or do you need to do that for me?
I think we are getting there.
because it's far too much stuff even for 10 minutes that I'd like to be able to jump around and control it myself if I could, because to go through this stuff slide by slide really wasn't my intention.
Fair enough. I think Hezekiah is working on that to make you the presenter.
Yay. So I'd love to share a few introductory comments. This is really an exciting time. Telemedicine has always been about equity. It's always been about access. Started out being about rural and urban, and we all know that that's not the case anymore. It's about efficiency. It's about being green, not transporting yourself for healthcare if you don't necessarily need to be transported. And I have a little bit of history and a couple of different PDFs that I put together as we continue the conversation and think about how that looks in terms of creating public spaces where people can have private conversations about their health. I can't share.
You can share right now if you go to the share option on your Zoom window.
This will stop. Yes, I want to. Okay, perfect. I want to share quickly, jump through just a few slides about the presentation that we did about a year ago about our pilot sites for telehealth and libraries. Now, looking at creating space in the library where people have access to technology, it's not about building clinics in libraries. It's about giving people access to technology. And really, before I start the share, I think it's in a really critical time right now as we think about how we teach technology. We want people to have access to tech. We need to teach them how to use it. And in the world of telemedicine and telehealth, we've always been about fiduciary responsibility too. So when we look at maximizing our bandwidth and maximizing our technology in ways that really give us the most bang for our buck for people, we really do need to look at how do we do that here in Arizona. This is why our program exists. 25 years ago, our legislators said we could save money if we can keep people in their communities doing the jobs that they do. If you're a sheep herder, if you're a copper miner, you are entitled to access to healthcare without being penalized because you live in a rural place. Well, now it's rural, it's urban, it's no matter what you do, but there are people that we have to agree are never going to have access to broadband or technology or ways in which they could get connected to healthcare the way we can. And it is about being efficient in transportation, efficient in broadband, all of the things that we do. So there's these great resource slides that I shared. But what we did when we started thinking about this 2 or 3 years ago, Mala and I started writing these grants. At the time, there were 5 or 6 other libraries, states nationally that were contemplating looking at doing libraries for access to technology. And here in Arizona, we did a couple of really great pilots, and I want to talk through them because when you think about it with regards to all of the different organizations we want at the table and where do people go for healthcare if they don't have a patient medical home, how can we get them connected to healthcare? Well, we can reach them in the libraries, in the food banks, with mobile health programs, so that now as our mobile programs park at places like the food banks and libraries, something I also want to frame our conversation about when we look at all those things, efficiency, access, care, and partners. This is a great example to talk through. So this was a demonstration to show that wireless was a great idea. It was 15 years ago, and the mobile health program for family community medicine would park at the food bank. What a great place to reach people and teach them about diabetes. We also did a jump up to the school, Amado. If you're not familiar with the community, it's just north of a checkpoint, and the school is the hub of the community. This is where people go vote, is the library at the school. And where do people grocery shop? At the food bank. So those two buildings are where you really want to reach people. And if someone is newly diagnosed with diabetes, they're given basically a prescription for a 6-week course in diabetes, right? To learn about nutrition, learn about all the things you need to do. Well, here's a family that could go to their own local library and receive the same 6-week course. And now that would be billable. You think about teaching technology, reaching people in their communities. Who are the first primary digital navigators ever? Were our CHRs, CHWs, and ASCHOWs, right? The community health outreach workers. When we did diabetes work up in the Four Corners area, just as we did in the southern part, rather than working with promotores, we worked with CHRs. Now, the folks there under the supervision of a public health nurse, but now if we were to have a patient in one of our rural communities where we have the technology in the librarian manages those resources. They can check the technology out. The people who are the link to healthcare are the community health workers that can teach their community members how to use the technology. So they've always embraced technology, much like our librarians, people who are the link to really entry-level link to healthcare in their own communities. We've done a great job teaching them technology for 25 years and they're on board and now their services are billable. One of the things I'm so excited about here is not just that it's billable. You know, if you want to measure success or communicate success, show me the money, the bottom line is always the bottom line, but also brings great respect to these people who've been doing the work, right? They've been the boots in the mud, the boots on the ground. And now by having them connected, whether they're at their chapter or at their school or at the community food bank or at the local health department, the more bandwidth people have and the more support in interagency work and private public partnerships happen, the more we can do. So we were very excited when we were at the Red Lake chapter. We threw a big party when the medicine man blessed the equipment and we had more bandwidth. Not only could we do connections to the primary care provider in Tuba City, rather than going from room to room in the internal medicine clinic to visit with patients, they would go to the telemedicine room and they would connect to those chapters and they could be looking at the patient's EMR while they're talking to them. This was over a single phone line. Don't you just hear that modem? So now with more bandwidth and more resources, we can do things like screen for diabetic retinopathy in patients' hometowns and cut their trips in half. The more we can deliver healthcare in people's communities, the more money we all save. So when you think about transportation, it's also about preventing transportation, right? Which is what I love about the talk of the app. You know, if you can prevent transportation, you take someone to the closest hub as opposed to 2 hours down the road, it's all about efficiency. So finding out where those mobile units can go, having routers, having them connected to their own electronic medical record when they're there is very efficient. Having the county health department be able to give people vaccines and immediately be entering that data into the patient database, that's efficiency. And I think about different mobile units and all the ones that are out there. There's one for every occasion. They are the breast cancer, the breast screening mammogram visited Tuba City so much that they finally set up camp and it's actually an installation. And this is really how clinics and healthcare services grow for rural communities. People travel there so often that that's how we build a clinic because we know we need it. We've outgrown mobile services. The other thing I wanted to share quickly is as we have also done the rollout for basic technology in 2 of our rural libraries, it also provides us the opportunity not only to show them that if they would like to take their own blood pressure every day, once a week, take their weight with a digital scale, these devices are in their library. And it also gives us the opportunity to take teams of our interprofessional students there and have our students get some good old-fashioned human experience and work with the local community and teach them and have them do screening and teach them about telemedicine and telehealth. So we now have these medical kits and medical tents, medical grade tents in Ajo and Arivaca Library. Tuba City is the next library location. It's a partnership with Pima County. We look forward to developing more locations. Many of the libraries here in Arizona do have blood pressure cuffs and different peripheral devices. Some of them have kiosks already so that they already have that nice space to create that private conversation. And really, when you think about it, it's just like an old-fashioned phone booth. You know, you need to be able to not only have a private conversation about your health, but in terms of providing access to people in our libraries, we want people to be able to check out a laptop and go do a job interview or something if that's what they'd like to do. So kiosks have come a long way. There are now grant opportunities for our libraries that they can write a small library grant for this. And Lauren and I have talked about, I'm sorry, Lauren, Aaron Larandos and I have spoken a little bit about putting together a directory, getting very organized as far as what resources are where in which libraries, because there are libraries that have very beautiful kiosks. This is a really interesting kiosk. Mala and I early on interviewed these folks. the breastfeeding kiosk. It's beautiful. It cleans itself. It's a private space. We met with these folks and said, would you be amicable to use these kiosks for things other than breastfeeding? Because we would like to be able to offer this in our library. And if we were to rent this type of a situation as opposed to purchasing. And it was a great conversation. We learned a lot because kiosks are very expensive. You can get things that are much just like a small phone booth. The VA has been working with Steelcase and they put together these little Zoom rooms. This has been now installed in many different VA locations. The latest kiosk that I saw at ATA this year was this cute little cube, Healthcare Cube. And I took a picture of the inside because having a patient exam area is really nice if something's absolutely going to be dedicated to telehealth. So as we move forward and look at these different ideas and ways in which we are using our space and ways in which we can now help provide healthcare nationally, there are now 20 states nationally, probably even more than that, that maybe we just haven't even heard about that have been doing telehealth in libraries. Some of them will tell you, well, gee, we could have bought a heck of a lot of tablets for one kiosk. Other libraries will say, well, our kiosk is booked solid every Tuesday, Thursday, so we're very happy we have it. We might buy another one. So it's interesting. The protocols are different. The resources are different. All of our libraries here in Arizona all have a lot of a wide variety of technology. But in the end, I think as we look at partners and we look at moving forward, I also have a couple of PDFs that I wanted to, that you can just review on your own as far as what you would like to know more about, you know, the kiosks. I took a great collection of kiosks and put that together. I put a great collection of mobile units. I also went into greater detail with the Amato example, because one thing I think that as we look at brainstorming those two concepts, I also love the idea that as we put together, like, for instance, an asthma screening package of technology for people to use in schools. The nurse goes to the school, they've got a hotspot, they've got everything they need. All they're asking for the school nurse to do is give them a small clinic room and help bringing the students to and from the nurse. Well, you think about all the great mobile units there are out there and all the services they provide. Well, when we did expand at the food bank in Amato, we poured in extra concrete pad. So now in Amato, there's the food bank, there's a clinic, there's a concrete pad, and there's a pass-through in the wall of the building. So if family community medicine, if the Piedmont County Health Department, if anybody wanted to go and park a unit, Chicanos Por La Casa, they've got a beautiful unit. You could park, if you think about facilities, facility management, resource management, to think about how you could park a mobile unit that complements the services that are already taking place, then you're really an asset. Because you're not asking for bandwidth, you're not asking for power, you're not asking for resources, you're bringing resources to the table. So I think about combining those two things, combining the whole idea of mobile units. So
I just because I think that that's a tremendous amount of resources that you have. And I do think in the context of some of our partners that we're looking at with the library districts in Yavapai County, as well as some of our partners in Southeast Arizona, I just think that it might be helpful even to have those slides kind of back up, Malaj, because I could see some potential questions I'm sure that are coming from our group, and I wanted to open the door for that here. So I'm not curious from the Yavapai County folks, is there any kind of takeaways from Janet's overview there?
Well, I know as a provider of health services, one of the issues we have is with patients not being able to make it to their appointments. Huge problem. With seniors, the problem we see is a lot of them feel they're a burden and won't ask family members for transportation, won't get the transportation they need, and then a manageable condition can become an acute condition. And that becomes costly for all of us, and it could be life-threatening for them. One of the things that would be hugely helpful for us, especially with the transportation piece of it, is to have the availability of transportation resources available at our front desk, because a lot of times we spend a lot of resources going back and forth with the patient trying to coordinate this. If we could book their next appointment when the transportation is available, that will save a huge step. And if we could see that, we can help coordinate their next visit with their transportation.
No, that sounds great. The resource that's immediately available would be the Easy Ride Info that has all of the transportation provider information. But ultimately, the Unite Us platform, I think, would be fantastic for that purpose. That'd be great.
And I know that we had some partners from Southeast Arizona. Again, we kind of have partnered or have been in conversations with the library districts about potentially applying for some funds for Yavapai County as well as Southeast Arizona. And so I'm just kind of curious. I know we have partners from SEGO on the call. If there's any questions or angles that they have in terms of looking in the Southeast Arizona area.
I guess my question is, so I came in, I wasn't part of the beginning meeting, so I'm kind of just have I guess a lot of questions. So I guess what is it that we're trying to do? Bring in these mobile units to the libraries? Is that what we're trying to do? Because I know that we do have in different areas, we do have mobile units that go out to the people out in areas we can't reach. I know that the problem in southeastern Arizona is that we can't get our people from rural Arizona to their appointments in Tucson or Phoenix because there's not enough providers to do that.
So this is Erin from the State Library. So the vans is one thing, but what's going on in some of our libraries already, what Janet mentioned was a pilot project in Pima County, and we're hoping the next stop that we're expanding to is Tuba City. And I haven't gotten approval of my budget yet, but I'm hoping to expand this to 3 more sites in this year in our libraries, where there's a physical kit of materials like a weigh scale, stethoscope, all these different things that connect through an app. And these would be available at the libraries for checkout. So a person could come to their library, connect to their doctor via the internet connection that's there, devices that are there, help that's there, and then use these enabled devices to take their measurements, whatever it is that the doctor needs, and it actually uploads right through this app that's installed on the computer already to their doctor so that they could read it automatically. So it's kind of a 2-prong approach. So there's the van option, and then there's also, if you can get to a library, you could potentially do the telemedicine appointment right there. Is that helpful?
Okay, yeah, because I did speak to the librarian and they were very interested in, like I said, because of the fact that, like locally, just to a doctor's appointment, they can probably get to one. But the thing is that when it comes to having them go to a specialist, that's when they can't. I mean, there's no one to take them from, let's say Douglas to Tucson or Douglas to Phoenix. And a lot of the providers are, far from them. We do have some transportation, but it doesn't go all the way straight through to Tucson. So it's very difficult for a lot of our elderly clients to get to those specialist appointments. So I didn't know if it was geared more towards like just regular doctors, or is it specialists, or both combined?
It's for everything, but it's not for everything. So, if you wanted to check out, let's say you wanted to have participate in a breast cancer support group in your own language, or if you wanted to do a food log for your nutrition specialist, there's a lot that we can do, but we can't do it all at a distance. And I think that, when you think about, those are some solid needs that you have. If you're going to see a specialist, if you're going to a podiatrist, it's because your primary care doctor knows you need something done to your foot. So transportation for appointments is not going to end, but efficient transportation for what your healthcare needs are is the idea.
Exactly. And adding to that, Jessica, I think the concept of that trip to Tucson takes a lot of resources, but the trip to Douglas, from the region may allow the transportation providers to expand their reach considerably. So that's where we're just trying to find, when there is a fit for these telemedicine options that we can kind of try to instill the infrastructure to actually be able to accommodate those. And so.
Okay, thank you.
Corey Christians, Yavapai County. We've had some chats with the Verde Valley Caregivers Coalition, and they've talked and given examples of they'll pick somebody up in rural Yavapai County. It'll just be a checkup, not a hardcore appointment where it's going to take an hour, 2 hours. They'll drive all the way down to Phoenix for this 5-minute appointment. It's
Right.
paid the entire way for this patient. And it would just be much simpler for them to go 10 minutes to the library, save them the trip, save the pain that the patient's having. As long as they don't need to physically see the doctor, it does open up a lot of opportunities with efficiency, as well as just, helping the patient out.
There's also digital stethoscopes that are part of the kit, because if a doctor is going to do a pre or post-surgery follow-up, they're going to want to listen to your heart sounds. Now, the thing that complicates that, the libraries have the software license in our 2 pilots. So you can record heart sounds and send them live to anybody who has that license. And of course, they have them at the College of Nursing for our teams. North Country Healthcare uses these same stethoscopes. They're very common in Arizona. What you would need is your provider to be also on the telehealth circuit. They would need to be providing their own technology, already doing telehealth, because we're not competing for people's business. We're not trying to create a way in which people are not comfortable to see their physician, but if their physician is doing telehealth, and we also already had the AHO librarian benefit from doing exactly this. She had the tools that her doctor needed to examine her in AHO, and she didn't have to drive to Tucson, which is a nice scenario. But our program, the Arizona Telemedicine Program and Southwest Telehealth Resource Center, we do regularly scheduled training, and we'll train anybody to promote telehealth services. But if your provider isn't currently providing services, then the technology isn't going to help you. But there's a lot that we can do with the technology that will help keep people in their communities.
So an important point that I want to try to capture here in this conversation is, we do think that this is an exciting angle, and there's a lot of work already being done around this. We think that there's some resources potentially for sort of the basic kit that's needed to outfit a library. I think one of the angles that we're very curious about, in coordination with some additional funding opportunities, we believe, is kind of what are some other supports that would be needed from the libraries that could help kind of really make this go. And so, Jessica, I think that's a really important thing for information that we're kind of seeking out of the SEGO areas. What would a library need to actually kind of, jump in on this? Because we believe that we have that basic equipment, but if there's additional add-ons, we think we have an opportunity to pursue to support that.
So I think one of the biggest things from that perspective is that health navigator. So funding a position that could meet in the library for those telehealth appointments, because again, the library staff really, to be honest, should not be asked to step into that role. And so to me, that's a big one.
And that's why it's so exciting for CHWs and CHRs right now. If a primary care provider wanted to have their patients take their blood pressure every day, they could bill for 30 minutes of a community health worker's time to go meet the patient at the library and show them how to do that. That's what that billing code is. And there are 3 billing codes. So fortunately, if that same promotor or CHW wanted to host a diabetes education class for a group of 6 people, that's all billable, which is really exciting right now. We've got the mechanism here in Arizona, which we can teach our digital health navigators how to teach digital health navigation and teach technology to their community members. So it's a pretty exciting time, because that's a critical piece, is the training part. And Erin's so spot on. Librarians are resource managers, and we want to absolutely complement their skills by having the technology available. But we do need to have that in place as far as teaching technology, which again, we've got great interprofessional teams of students who can do that. And then now we've also got, if we work with our FQHCs and our primary care providers who do have CHWs on their payroll, then we've got time, and we've got the personnel to teach the tech.
Curious on that front, is there, within some of the pilot areas we're looking at, is that an area that we need to really jump in on and try to identify those, make those connections?
Well, that's what we're doing with our pilots right now in Ajo and Arivaca is, you know, getting the primary care providers involved and looking at how we could bill and when we could bill, because that's how we're going to be able to communicate our success.
And I think too, and Janet's been a part of the pilots for the whole time. I'm stepping into the telehealth space, just for context. So she can definitely give more information on this. But what I've learned from what I've heard about our pilots is that, you know, advertising that it's there and connecting to the health providers is that next step, because the materials might not be used to their full capacity otherwise. And, you know, continuing to let the communities know that they're there is also key, which is how we're hoping to kick off into the city. And Janet, I don't know if we're ready to talk about, but we're hoping to plan weekly or monthly, at least, events to connect virtually with resources in the areas that have these kits through, we're calling them like, well, pick a day of the week, but, you know, telehealth Thursday or whatever it is, where there's going to be programming around this in the libraries as well to kind of bring awareness and also to increase circulation, which of course will increase the awareness by default. So, so we're working on that stuff too. Exactly.
So Will Humble, you're an expert with regards to the billing and the long hard road it's taken us to get here. Could you help shed some context on the CHW CHR Promotora billing?
Well, I can't give you, only in the sense that on the ASCHO website, they have the codes. I know Access is reimbursing now under one mechanism, and they're working to expand that to make it more flexible, but that's a few months away. My expertise is really goes back to trying to make this happen in the first place by, first getting the bill through the legislature back in 2018. Heather Carter was instrumental in like really working that bill to give the state health department authority to certify them. And they finally wrote the rules. They are certifying community health workers now. And that was the ingredient that was needed in order for Access to open up those codes and allow for reimbursements through their managed care organizations. And that's all happening now. So it was a long slog. It took like 10 to 12 years to make this reimbursement loop happen. And it is happening. And I know that, so I'm not an expert in how to bill it all out, but I know the ASCHO, the Arizona Community Health Workers Association, their website has the tools, and they had a Roots conference last week, which I was fortunate to be able to attend part of. And the back of that conference program has like a flow chart for how CHWs, once they're certified, can bill through those 3 different codes.
Real quick, Corey, I believe you were trying to get a question in.
Yeah, just as far as these health navigators go, now, are they employees of the library? Are they employees of the clinic or healthcare facility? Is that how
all of the above?
Okay.
All of the above. So, Erin has developed a team of digital navigators, and we're working on developing digital health navigator resources for them. There are people who are trained as digital health navigators. Vitalist Foundation trained 75 health insurance navigators. So putting together a directory of who those people are and who they work for would be very helpful in terms of matching that then to where the resources are located.
Now, could they be independent contractors, or do they have to be associated with the healthcare agency?
I would imagine they could be independent contractors.
Okay. Thank you.
So outside of the healthcare navigator, the kind of staffing support that's needed from that, I'm just kind of curious in thinking from the library's perspective, and Jessica, with any of the conversations that you've had, any kind of additional infrastructure elements that we think could be, I know there's a lot of great information there on those pods and all those elements. Like, is there anything that we've kind of identified that could be really hold a lot of value to really kind of push these, make this happen, that there's a need for in the context of thinking about some of the potential library applicants, some of those other resources?
Well, it seems like there's a lot of parts to this that are still kind of question marks to me, mostly within the minutia of it. So for instance, with the software involved, where one of these navigators is taking vital, whatever, and they have to upload it to the doctor or that doctor's healthcare facility, is it all compatible? Are there different formats, just for instance, for how the data is being uploaded? Does one software system not work with the type of data format that's being uploaded into it? How do we get around those kinds of issues? I mean, if we're working with one facility like Yavapai County, that's one thing, but if they need to connect with Phoenix Children's or Barrows or however it's pronounced, or somebody else, how does that all handle?
There's data that's exchanged, and of course it's encrypted, but it's not a matter of interfacing with anybody's network. That's why the library has the software license for the stethoscope. It's not that the library is we're not interacting with electronic medical records at all, unless a library patron goes to the library and their healthcare provider uses Epic, and they've got the version of Epic that has the nice little video conferencing window in it. Well, then that person would just need to log on to their own healthcare provider website and connect to Epic. You wouldn't be interfacing with Epic at all. Does that make sense?
Sort of. So if they're taking the vital information, is then the doctor just viewing that in real time, and then that's all that matters? Like somehow between that session, they're able to see the results of the devices that they're using, or is it they're taking that information and then somehow having to upload it into another system so the doctor has it?
No, they're not doing anything with their own data in terms of putting it on the library protocol. Is you use the device to access whatever websites that you would like, and then the laptop's wiped clean for the next person. And it's not a matter of interfacing networks.
Not networks necessarily, but software is more my concern than networks.
It happens.
Right. Well, you're logging onto a website that has the software. We're not, the only software that's going on the laptops is the HIPAA compliant Zoom and the library software license for the stethoscope. At least for the two pilots. I mean, any libraries can set this up however they would like, but not to interface with the EMRs is the idea.
Okay.
And to that point, I just wanted to say, from the state library funding perspective, we're giving a list of suggested things. Each library, of course, gets to do what they want to do and what they feel is correct. But the slide that Janet had up momentarily is the recommended list of what could be put in a kit, but it does automatically. So basically, if you think about it, when you step on your scale in your bathroom at home, you see a display. When you're in the doctor's office, the person doing your intake sees that display, marks it down. In this case, you'd be in a space where you're doing that in the library. That device itself is connected through the software, and that display readout for whatever it is, weight or heart rate, whatever, goes directly to that software, viewable from the doctor's perspective.
And one other quick question about that is when we're having some initial conversations with the Yavapai County Clinic, what about liability concerns for having this navigator who's presumably received some sort of certification interacting with a doctor from another agency that they may not necessarily be a part of? Is there any liability concerns with that?
As long as everybody has a signed HIPAA form and the person is okay with having that person sit there with them, there is no liability. But I think individuals who are serving that role must have a signed HIPAA form with each individual that they're working with.
So that's correct. As long as I have the proper documentation, there should be no problem with that. They just have the sign information. Sorry, that's not. I did go to law school. Anyway, but one of the questions I had Are you guys connected to, is the library connected to any of the independent living centers? So they can bring people there to do the process? Independent living centers like direct independence or.
Yeah, that would be a great partnership, the independent living centers or yeah, exactly. And that would be a great, once the kits are in the libraries and we have, the process, that could be a great partnership to bring people from an independent living center, for example, in the area to the library to do their, to do their appointments. Exactly. Yeah.
Right. So I do think that we kind of need to move along in this discussion, but I know that we've made the connections, at least from Yavapai County standpoint. I mean, I think that there's a lot of really good questions, and I think that, as you can see, there's a lot of expertise within this group. And so I think we can continue to kind of look down that angle, but from kind of an action item, I do think that we'd be really curious to hear, maybe through the next couple of weeks on if there's additional supports that are needed that potentially some of the funding opportunities that we believe we have access to could support to make these things happen in Yavapai County, as well as in Southeast Arizona. I think that'd be kind of our next step. So, but I do want to, especially, and I'm not sure, Zacchaeus, if I can power this anymore, but telemedicine vans, which is very similar. And I think that we've kind of talked a lot about, this is just another angle, but it's kind of taking it a step further. I'm just picturing, kind of a rural town with the library, but now we're kind of going to the way in the outskirts where maybe there's a telemedicine van that could be pulled in. There's been some conversations, and I know that there's a lot of work happening with the Tuba City Library, but there's also conversations that I've had with the Tuba City Regional Medical Center, and I'm hoping that there's some staff from that call. I believe that they're on the line that could talk a little bit about kind of the background of Tuba City Regional Healthcare. They kind of had an established vision of pursuing this telemedicine van that was kind of cut short on some of the how the funding matched up, but they do have a lot of this equipment. And so I'm curious if there's someone from Tuba City that wouldn't mind introducing kind of their vision.
Hey, this is Dr. Mayer in Tuba City, and we just had a fire alarm go off and we have to clear the building. So maybe you can reschedule us for a little later in the meeting. Sorry.
Okay, that's okay. That is perfect timing. Yeah. Shoot, and I'm disconnected from the internet here. So if they had a fire alarm, I think that's ongoing conversations that maybe our project team will have, but I'm just curious, especially given that we have so much expertise with Janet on the line regarding how this is deployed. She kind of provides some examples, but if there's questions or other kind of examples or areas for us to explore around these telemedicine vans, I think we just kind of heard or saw that there was a lot of a running start with the Tuba City Regional Medical Center. I'm just curious kind of from other pockets of the state or if there's interest elsewhere.
I can share more pictures if you'd like of other mobile units.
I think, well, I guess, or we could, yeah, go ahead.
So with this many folks attached to libraries in the room, which just delights me, I can't even tell you how happy this makes me. Are there mobile book vans? Yes. Yeah. So is there any potential crossover? No, not in Yavapai.
No, we intentionally have tried to build as many libraries as we can in Yavapai to avoid having something like a bookmobile, because we know it's easier for them to go to a local library than to have somebody drive something all around. And
I want to say there's like 11 in the state right now.
Oh.
And I know Cochise doesn't have one.
Yeah, but some are starting new ones. So,
Well, it's a great way to spread the internet around the state because they've got nice routers up on, they've got nice antenna up on top, and they help partner with other services too.
They definitely, to Corey's point though, it is a whole nother position to run a bookmobile, which library can afford.
And plus looking at some of those ones you've seen are, probably anywhere from $100,000 to $1 million. So yeah, I'd rather building.
But yes,
my point was not to build more to cost anything. My idea was if those are already if there are 11 already in place and potentially there's more coming on, is there some sort of natural partnership here with what we were talking about?
There definitely is. Another example that I like to bring up, when the Super Bowl was in town, actually, there was an organization, the Jerome Bettis Foundation has a digital literacy van bus they take around. And that's another really good example of how this could look, right? Because they're basically computer workstations. Now you'd have to build up privacy walls a little bit more for this application, but there's definitely, if there's space within an existing vehicle, this could be a telehealth location. It could be a digital literacy learning opportunity. It could be a lot of things for sure. I think that, to Corey's point, it's not always feasible for other reasons, and that's why some of them have gone away. But yes, and to Janet's point, yes, we can put, a Wi-Fi hotspot in there and bring internet and all of those things as well. Yeah.
Because ultimately, I mean, at full build out, I do think it'd be really interesting to see if we can partner with different kinds of entities around that mobile health van. So for example, if we could partner with the libraries, if they happen to have a mobile library unit like that. But also if there's a van going out to somebody for a medical appointment, for a telemedicine appointment, could they also bring the food box? So can we really fully leverage that visit as much as possible, looking to a variety of different partners who could help.
Now, a telemedicine van for some place like Yavapai County is pretty intriguing because many of our libraries don't have a meeting room. I mean, they may be a 250 square foot building or a 1,000 square foot building, and they just don't have space. Others have meeting rooms, and it wouldn't be an issue. But you could just move that thing around the county, move it right next to the library for the amount of time it's there. And that would work out really well. Now, combining a bookmobile and a medical service with it could be a bit challenging because usually those vehicles are fully dedicated towards having books, computers, other sorts of things in them. But I still see a big opportunity to have the van parked next to the library, or if there's no library, there's some other significant civil building or others that they could work with.
Well, it's too bad we didn't have Tuba City outfitted with their telemedicine van right now, because they could have just gone into it and continued along this conversation. But I do think that, again, maybe that's a conversation we'll take offline, but bottom line is, we were really curious to explore the needs of the Tuba City Regional Medical Center as it relates to our potential funding opportunity, which I do think maybe we can kind of move that along or tie that into kind of the final agenda item that we did have, recognizing that we've got about 25 minutes left. But, I think that we've had this long kind of tier variety of conversations going in again, a million different directions, and kind of recognizing that there's a lot of value in having these meetings and having this kind of structure, as well as the opportunities that we have, but kind of just hearing from the group on how do we want to kind of move along. And I think Amy was going to introduce the funding opportunity as well, as we kind of look to tie things in and close out this meeting and look at the next steps. So.
Great. Thank you, Todd. Really appreciate everyone coming together. There was a question in the chat about what do we need from the area agencies on aging? Is it funding? And of course, we likely not refuse funding from anyone, but right now I think it helps to think about these partnerships, particularly in terms of resources, but resources broadly. So a resource could be expertise. A resource could be, hey, I know this person and they could be a big help to this project, so we are looking for resources and yes, funding as well. We do have an invitation from the Harry and Jeanette Weinberg Foundation. They're a national foundation. They are the ones who funded our Rural Transportation Incubator for 2 years, which was fantastic. They provided $300,000 for that 2-year effort. But thanks to our partners, though, we're able to commit to and deliver $1.5 million in cash and in-kind contributions. So it's a great example of Stone Soup. I'm not sure if you're familiar with that story. Yeah, some are, where, where one person might throw in their potato, another person has a carrot, another person has, barley, whatever, but it all starts with this, and, with this big pot of water, right? Well, anybody has a pot of water. But if, each person contributes what they can, then together we can make a really good, nutritious meal that can sustain us. So it's the same idea. So we're looking for resources. So the Harrington Weinberg Foundation is a potential resource in that. They've invited us to apply for $200,000 this time. And their funding is more specific as a primary purpose for capital, for a capital award. So it could be the van, it could be technology, it could be the mobile unit, you know, the one that was in there for nursing. And so it could be that, you know, things that we can buy. But that being said, I heard earlier that, hey, if we could get Health Navigator position funded, you know, that Weinberg likely wouldn't be the best resource for that, but others may be. And so it'd be great if you could contribute, not an open wish list, because I know that could be all encompassing and consuming. But just if you have ideas for things that you might need to partner in this. So maybe for Tuba City, maybe it is a van, you know, maybe with the libraries, maybe it is more of those packs or something like that. If there are resources that you'd recommend for this, and if you could send those ideas along with kind of a cost estimate, that would be really helpful, because in the next few weeks, we'll be refining the scope for the grant and also developing the budget. And so we'd love to be able to work with you on developing that, because again, we want this to be useful. We want this to be something that helps you deliver your services and to achieve your mission as an agency. And we want to be able to fully integrate your expertise and your needs into the development of this grant request. So if you have ideas for that, if you could get that to me at least within the next week or so, that would be fantastic. And again, it's not necessarily, you know, this is everything that's needed, but just as it pertains to what we've talked about today, any ideas that you might have. We will need to look to other potential funders. So if anyone has access to that, either directly from your agency or you know of someone else who might be a funding partner in this, please do let us know. With the Harrington Weinberg Foundation, it wasn't by accident that they gave us $300,000 and we committed $1.5 million in kind and cash match. That's their match. The ratio for match to grant funding is not what I've seen in other grant sources. So generally other grant sources will provide, say, 75% of the funding, you come at, you know, and then you come in with 25%. It's kind of the opposite with this one. So we'll need to be able to provide a lot of cash match and in kind, but the in kind could be the majority of that. And so that could be your staff time. It could be, hey, we've got this grant through a library already. We can, and it aligns really well with this project. So we don't necessarily need to get cash for everything. It's more so those in-kind contributions that further the mission of this overall project. So I want to stop there, see if there's questions, see if you have ideas. Love to open the floor for your input. Yes.
One thing is we're in the middle of a broadband build out, both in Black Canyon City and Congress in Yavapai County. And Cox Communications was a successful bidder in that process. And as part of their contract with us, they did commit some funds towards something that could be considered telecommunications related. So now that we know there's $993 million worth of BEAD funding coming to the state of Arizona, it might be worth it as we're looking at ISPs starting to put in contracts and bids for some of these projects. It's always worth it to see if they'll throw in some of their own money for initiatives such as this, which they tend to be willing to do. Our other vendor that we're working with, Altice, who we've since fired, but before they were fired, they also committed to putting money into projects such as this. So it seems to me it's probably a fairly common sort of thing for these ISPs to say, hey, we're not just here to get your business and provide internet service. We also have $150,000, $200,000 we'll put towards whatever. Just let us know what you need it for. Perfect. That sort of thing.
That's a great idea. Thank you. Really good. We'll definitely follow up on that.
I do have a question about the digital navigators. Are they particularly trained to communicate with people with developmental disabilities?
We do our best to be as inclusive as possible. It's something that we're definitely aware that, you know, there's always just a little bit of history on it. I don't know if this was shared at the last meeting or not, because I missed the beginning of it, but it started out as an early pandemic response. kind of filling the gap for folks who couldn't go to their libraries to ask the, you know, the resource questions and things like that. But recently we've been much more intentional about growing it. I think that there's definitely room for growth though.
I was thinking maybe we could help with funding if you want to train people out here to work with people.
Be wonderful.
Anyway, I have to go back to my team and see if we can do that. But
There you go.
right.
Thank you.
Excellent. Thank you. No, great ideas. Other examples of partnerships. So Arizona at Work, that was a great suggestion because they have locations throughout the state and they already have those video interview rooms set up for virtual appointments. So they could be a really nice partner in this. And that was a recommendation from Zena, and Jason knows folks here in at Maricopa County Human Services. So that would be fantastic. So thank you for those ideas. We definitely want to make sure that we have the right partners on this and would look for your support to determine who that might be and what their role could be. Excellent. Other thoughts about possible partnerships, thinking about resources really broadly? Any other ideas?
Amy, this is Jason Matthews.
Yes, Jason.
And just kind of thinking, way outside the box here. I know I don't recall in this conversation, and maybe this happened in previous meetings, but potential partnerships with school districts. And only because school districts, I mean, not only from the internet perspective, but also on the food service perspective, and even some of the mobile transportation. I've seen in some of the rural areas, especially on eastern Arizona, where those school districts, whether through like a family resource center or some other kind of thing, they've had to go mobile and try to do these connection points when it comes to not just internet and learning and capacity building, but also in the connection with food, and even, quite frankly, even some of their, their nursing services or things like that. So that's just a weird outside the box thought. I'm sure it's been covered before, but I just want to say that loud.
No, that's a great idea, Jason. Thank you. Really appreciate that suggestion. And it's not been a robust part of the discussion so far, but definitely has potential to be. Thank you.
I actually piggyback on that. I would assume that school buses are available in the middle of the day. Is that correct?
Generally, yes.
Could those be modified in some way?
That's a great idea. Thank you.
And in that point, I've actually seen some school buses that have, there's been some really creative applications for the school buses, and even school buses that are kind of at the end of life, kind of like towards their, and just, a little things that can be easily modified. Now, granted, they get a little bit more expensive towards the end of life, but at the same time, there's been some creative ways. And again, just thinking about, dealing with like food insecurity, for example, like there's some interesting things, or even like mobile, internet usage I've seen as well, like literally like putting a school bus and outfitting it with like a Wi-Fi antenna and almost kind of driving around the neighborhood a little bit, which sounds kind of silly, but those are some things I've seen, when school districts at the very beginning of the COVID-19 pandemic and dealing with just broadband access and the digital divide. So maybe outside the box thought, but maybe something worth pursuing.
Awesome ideas. Thank you.
And just to throw another thing out there, since Mala's not here to say it, I know she would want me to say it. Schools and libraries can get reimbursed for internet access and technology through the E-rate funding as well. So that's another really important aspect of that. If we can put Wi-Fi repeaters on all the buses, that could be a reimbursable fee.
That's awesome. What's that funding source again, please?
E-rate.
E-rate
through USAC.
Okay.
And Mala, who's been in these meetings prior, but she's at the Arizona Library or the American Library Association conference right now, so not here. But she's our E-rate coordinator for the state.
Excellent. Thank you very much.
Another thing on that same out of the box thought there is that our superintendent of education in Yavapai County has several mobile healthcare professionals, mostly nurses, that will go out and visit some of the more rural schools. So you put them in one of these vehicles and they're good to go. The staffing's already there.
That's awesome. Thank you. I was also thinking about
blood mobiles that may be coming offline because they're already outfitted for privacy. I know it, again, we're talking about mobile assets, and those are assets that may be aging and we may be getting ourselves into more trouble than it's worth. But just as a thought that they're already built out, they typically already have Wi-Fi aboard, all of that.
Oh, perfect. Yeah, excellent. Thank you. No, great ideas. Yeah, please do keep them coming. Anything else on this? Yes, sir.
I would be interested in talking to other FQHCs and see how they deal with this. One of our concerns is I just got done doing our FQAC for our malpractice insurance and see what coverage we would have and if they would allow us to use community health workers or navigators, and if that would fall under our coverage or if we would be excluded from participating in that.
That is an important point. Yes. And we found sometimes when agencies are really wanting to partner, the insurance is often the barrier. Dee Dee?
Hi, everybody. I apologize for coming late to the party. My name is Dee Dee Castilla, and I am the Human Services Transportation Program Manager here at MAG. And I just have a question since we're throwing everything out. Do we know what happened to all of the COVID equipment? I know they did mobile triaging and, you know, they had laptops, they had tents. And when we're talking about possibly having the bookmobile, you know, the partnership, maybe we could have a tent on the bookmobile where they pull it out and then set up an own separate place. But I'm just curious. I mean, they had quite a few laptops, they had tents, and they were all over the state.
Yeah, to that point, Dee Dee, I think maybe Embry Health could be a partner in this. I know Embry had a big contract. I think we probably saw those vehicles in all of our communities. Potential outreach point.
And I also wanted to add to Amy's point, when they're talking about resources and what you'll need, you know, to get a lot of these projects off the ground. And there are a lot of, there's not a lot, but there's some grants out there. We have a couple mobility managers in the room who help with mobility. And we have a grant program called the Section 5310. And it's actually really getting the consumer to the services instead of bringing the services to them. But there could be a partnership in this. So really think about what are the hardware, and has federal grants are always, is mostly assets, you know, it's really hard to get operating from a lot of federal grant programs. But, you know, if there's something, you know, really think about what you would need, you know, kind of envision if it was already in play, what are some of the equipment that you would need, and maybe Amy's great at looking at, you know, where can we get different resources? But I just wanted everybody just to kind of, you know, imagine that it's already in play and what we would need to get it going. So thank you.
Oh, that's great, Dee Dee. Thank you. It's a great funding source, very stable. Good. Todd?
Sure. I guess I just was kind of wanting to maybe set the stage for the rest of the summer here, as it does seem like that from what I'm hearing, some of the kind of initial concepts, I realize that there's a lot more information that we need to explore with some of the individual partners. But first, with the exception of Tuba City, because we didn't really hear what they thought about any of this, but we will be following up with them. But in terms of kind of some of these pilot projects that in my hearing that this group does think that these are worthwhile angles to pursue, and they're kind of recognizing that they're kind of be viewed in the pilot capacity, but in the context of them being able to be potentially replicated and kind of lessons learned to be expanded upon this model kind of around the state. And with that this group would like to continue to kind of meet collectively like this, you know, throughout the year to kind of follow the progress of these projects. So I want to make sure that I'm not signing up the team that's maybe potentially not interested in that. But or if there's ways that we could further kind of channel and direct this group, just because it's a very impressive collection of expertise that we have here. We want to make sure we're using everyone's time best, but also kind of tapping into that knowledge. So
Absolutely. One of the ideas that has been carried through from the first summit and then the second one and then now this one too, particularly moving forward, is that there seems to be a lot of interest around having a healthcare transportation kind of task force. And it doesn't necessarily need to be very formal and have, a lot of structure to it, but just the opportunity to bring folks together to be able to continue these conversations, I think could be really impactful. And so one of the things that we're thinking about is offering an invitation to those who have participated in the summit so far, plus any others, if you might want to continue these dialogues with us, being part of the task force. And then we'd love to be able to explore how we might be able to help each other through this work moving forward. So then that would be one of the next steps. Kelly?
Could we possibly include field trips with that so we could actually go see what some of these?
Oh, that'd be
sites look like?
great.
I think it would be helpful.
Yeah.
I think if nothing else, it might be inspirational too.
Yeah, absolutely. That sounds great. Good.
Just, I do want to mention or recognize Hector's comment regarding what we considered Waymo, fully autonomous ride-hail service, strong relationships with groups like Foundation for Senior Living, Lighthouse, and the Lighthouse for the Blind, plus exciting partnerships with organizations like the CERN Grove Festival and the Arizona Diamondbacks. No, but I'm interested. I do think that would be a very interesting, if there's contacts or ways to pursue that. I'm curious from the local MAG office, if that's
Amy,
angles you guys are pursuing.
didn't we start this conversation with ASU with Waymo about a year ago? Am I remembering that correctly? Remember we were talking about self-driving cars, and I think it was specifically with Waymo.
We have had some very preliminary conversations, but it'd definitely be something to revisit.
And I also want to point out that there is a autonomous vehicle company serving Sun City, and they are focused in older adults and people with mobility, with people with disabilities. So yeah, it's also autonomous, just like Waymo.
Very good. So the next steps, we'll be reaching out to you within the next few weeks with a draft scope and budget for the Weinberg grant application. So if you wouldn't mind taking a look at that, letting us know if we're missing anything, if there's anything else that you might add, if you have any potatoes, carrots, chicken, anything like that to add to our soup, that would be wonderful. Also within the next week, if you could please let us know if you have any ideas for any capital requests that we can include in that grant application, that would be particularly helpful. You have the expertise in terms of what would be useful and what the associated costs might be. So it would be great. So first step for next steps would be if you could let us know that feedback, and then we'll follow up in within just a few weeks after that with a scope and budget, so, as well as invitation to participate on the task force. Marisa, do you have something that you'd like to contribute?
Yeah, I just wanted to say, will you be needing like letters of support from some of the community partners for this application? And if so, could you send us a template so we can, if you think that will be helpful, I think most of us will be more than happy to do so.
That would be wonderful. Thank you so much. And with that, and thank you, Mauricio, and I'm not sure if you're intending this to be part of the template, but if you'd like to quantify any in-kind contributions, it could be your staff time, grants that you have that are related that could directly impact this project. If that could be included in the letter of support, but if it is exclusively a letter just saying we support this and we think this is important, then we'd love to have that as well. Thank you very much for offering that.
Thank you.
And yes, we will send out the template.
One other piece, just because I do recognize people have been kind of in and out of these conversations over the past couple of months. Hezekiah, I believe you're going to drop the link to the N-CATT team, which we didn't get a chance to really, I think they introduced themselves early on, but they did help put together a report that sort of documented the sort of progression of conversations that have taken place up to this point. I believe they'll also be adding and incorporating today's feedback into that report. But there's a hyperlink that will be dropped into the chat, and we can share that out with the whole group as well. It just has some background on kind of this report that will be added to help kind of structure this conversation, because we do recognize that there's a lot of ground that we've kind of covered over the last couple of months. So. Is there anybody from the N-CATT team, Andrew or Eric? Do you have any comments on that, or is it kind of a conclusion here from the work we've done with you?
There's nothing on my end, so it's just cool to hear about all of the great stuff and as Amy said, the stone soup that everyone is putting together to make this come together. So we will definitely follow up with more an updated report based on this, and then we're around for any questions that anyone has. So if there's any transit tech things that you want to know about, or transit things in general, then we're happy to talk about it with you and connect you to resources or kind of tell you all about it. So feel free to reach out to us at any time.
Any other kind of final comments from the group as we, I guess we'll be sending out a lot of emails with our asks, I guess, or your asks.
Yes. And we will also include the links that have been shared in the chat during and any other links that might be identified after that. So thank you everyone for contributing those links. Is there anything else that we can provide or do right now to help you engage in this project? Okay.
Curious if anyone's up for a field trip to Tuba City, if that's where this
Would be
telemedicine van
awesome.
is going to be.
That would be very cool. Yes, we can definitely look into that. Thank you. Okay, great. Yeah, the mag vans and the gas card. Let's go. All right.
Okay, well, with that, a special thanks to everyone who came in person and to all those online. And we'll be following up. And please reach out if you have any kind of specific questions. I think we have kind of our project team of Amy and myself and the kind of the MAG team. Yeah, we look forward to continuing these conversations. I think we've made a lot of great connections through this work, and seems like there's a lot of work to be done, but I think that we have the right group. So looking forward to it. And thank you.
Thank you.
Thanks all. Have a great day.